I absolutely refused to be pregnant one day longer than I needed to be. But I do think it's important to understand the difference between being term and being full term and why we don't electively deliver prior to 39 weeks. So yes, you are technically term when you hit 37 weeks, but we call this early term. Once you hit 39 weeks is when you're considered full term. Then at 41 weeks to 41 and 6 is when you're considered late term, and then after 42 weeks you're considered post term. And this matters because when we look at the overall outcomes based on gestational age, we know that there are worse outcomes prior to 39 weeks. So what we see in those babies born in the 37th or 38th week is an increased risk in respiratory morbidity. Mostly at times you need to be put on a ventilator. Now you have to balance this respiratory morbidity with all the other things going on in pregnancy, because we know that there are medical conditions both on the maternal and the fetal side that have recommendations to be delivered prior to 39 weeks. And so you're balancing the risks of those medical conditions with the risks of respiratory morbidity and mortality. And in those situations, the risks of the medical condition outweigh the risks of the respiratory morbidity, and that's why we recommend delivery prior to full term or 39 weeks. But if you don't have any of those medical conditions, the risks of the respiratory morbidity are higher with no benefit on this side. And so that's why if you're electively being induced or you're having an elective repeat C-section or an elective C-section upon maternal request, we do it after 39 weeks.